Hola amigos y amigas de la Silla Rota y su médico. El día de hoy nos encontramos con el doctor Weissman, inmunólogo estadounidense, el cual recibió el premio Nobel de Medicina en 2023. Obtuvo este galardón internacional por ser el co-desarrollador de vacunas de ARNm eficaces contra el COVID-19. It's a pleasure, doctor, to be here with you. And well, so we know that COVID it was a pandemic that changed our lives. So how has the COVID pandemic influenced the speed and approach of vaccine development?
So there's really 2 points to that. It certainly has sped up vaccine development, both for RNA and for other platforms, for adenovirus, for protein adjuvant. Never before has any company or anybody developed a vaccine so quickly. That's incredibly important because it gives us something to build on for the next pandemic. The other problem, though, is that the COVID-19 vaccine has killed mRNA research because of the speed and the efficacy and the safety. Many anti-vaccine people have now attacked RNA, making up stories about how it causes cancer and infertility and all sorts of crazy things. And because it was made so quickly, people have attacked it more than any other vaccine. So it's going to make the next RNA vaccine and the next RNA therapeutic a lot harder to get people to accept.
Okay, well, you mentioned the two things that are important, but first of all, what recent innovation in vaccine technology have you found most promising for addressing current and emerging diseases?
So RNA is not just a vaccine platform. 2 weeks ago, there was a publication in New England Journal of Medicine, the top medical journal, out of CHOP, which is our sister hospital, where they cured a 6-month-old child that had a genetic liver defect who was going to die. And a researcher at Penn used mRNA LNPs to cure their genetic disease. There's been other genetic diseases that have been cured with mRNA. We have a clinical trial going right now that we hope will cure severe autoimmune diseases with RNA LNPs. So the broad distribution of diseases that RNA can treat is enormous. And I think they're all going to be exciting and they're all going to change medicine going forward.
A point in our lives. And what role does ongoing research play in preventing future pandemics?
Yeah, so this has been something that governments have never quite understood. We've been working on pan-coronavirus vaccines and pan-influenza vaccines. These are vaccines that treat any new coronavirus or influenza virus that appears. Our funding was cut by the NIH, and many governments have cut funding for universal pan vaccines because it's a lot of money. And governments in general would rather wait for something to happen and then react than to look ahead at what could potentially happen and stop it before it happens, because it's much cheaper to wait for something to happen and then quickly try and solve it.
So you mentioned that one of the problems that you faces when you are trying to do more research. What are other problems that you see nowadays?
Yeah, so there are a lot of problems. One of them is the technology, and technology develops at kind of a linear rate. New technology keeps coming out that's better than old. But at the same time, you need people. You need people who have the idea of how to use this technology to treat a new disease or to develop a new type of therapy. Right now, in the United States, they are canceling researchers. They're blocking researchers from coming overseas. They're canceling training grants. So we're losing all of our personnel that it would be replacing people like me in the future doing basic science. So we're losing money and we're losing people. And both of those combined, I'm afraid, are going to set back biomedical research for decades.
And then you mentioned in the first questions about the myths about vaccines, about cancer, and that kind of things that people say. So it's most about the anti-vaccine movement. What do you believe is the most significant impact of that movement?
Yeah, I think it's, I think probably the biggest impact is if you look at measles in the United States, where we're having thousands and thousands of cases. 2 people, 3 people have died. 2 kids have already died from measles. We have whooping cough coming back. We have tetanus coming back. As fewer people take vaccines, we're going to have more and more of those preventable diseases coming back and more kids dying.
Yeah, so what do you envision as the future of vaccine in terms of technology and public acceptance?
Yeah, I'm a basic scientist, so public acceptance isn't my specialty. I try, I talk to people as much as I can to convince them to take vaccines. We have vaccines for cancer, for pancreatic cancer, for melanoma, that have shown they work. Uh, in the past, nothing cured pancreatic cancer. This is a great breakthrough. We have vaccines that we're developing for autoimmune diseases. We have gene therapies. We've got all sorts of new therapeutics that are being developed. The important thing is that people take these treatments.
So thanks for your time, doctor, and it was a pleasure to have you here.
Thank you very much.